question and answer session. To ask a question during the session, you'll need to press star one on your telephone. Please be advised that today's conference is being recorded. If you require any further assistance, please press star zero. I would now like to hand the conference over to our speaker today, Michael Schomer. Thank you. Please go ahead, sir.
Thank you for joining us for the COVID-19 media briefing for April 22nd at a slightly different time today. We'll start with opening comments from Health Commissioner Jan Malcolm. She'll be followed by Minnesota Education Commissioner Heather Mueller and Dr. Brooke Moore, a pediatric pulmonologist with children's respiratory and critical care specialists. After those opening comments, we'll take questions. With that, I'll now turn it over to Commissioner Malcolm.
Thank you, Mike. Good morning, everyone. In just the last week, there have been an additional 5 million cases of COVID-19 around the world. The cumulative total is now almost 144 million cases and over 3 million deaths. In the United States, we're now at more than 31,800,000 cases and 569,404 deaths. It's been noted that our rate of growth in the United States overall has come down from the very high levels we were seeing a few weeks ago. But as CDC Director Walensky and others have said, it's the decline seems to have leveled out, and we're now at a pretty high rate of daily case growth. At yesterday's, for example, was just under 70,000 new cases and 929 deaths. So not as high as we had been seeing, but still at a very high level, and at least recently not falling further. Here in Minnesota, out of about 43,800 lab test results that we received yesterday, there were 1,973 positive cases that are being reported today, bringing us to a total of 562,420 cumulative cases since the start of the pandemic. Unfortunately, we are reporting another 10 COVID-19 deaths today, bringing us to 7,054 total Minnesotans who've lost their lives since the start of this pandemic to COVID-19. There are 683 people currently in hospitals in Minnesota being treated for COVID-19. Of those, 196 are in intensive care, getting very close now to a cumulative total of 30,000 people having been hospitalized, and over 6,000 of whom have been ill enough to require intensive care. On the vaccine front, almost 3,840,000 total vaccine doses have been administered to Minnesotans. That's the combination of first and second doses. The number of people with at least one vaccine dose is almost 2,350,000, which is 42% of our total population in Minnesota. The number of people who've had a complete series of vaccination is now over 1,670,000, or just over 30% of our total population. We really do believe that the end of the pandemic is within sight, but we're not there yet. And frankly, how quickly we get there is not a given. It depends entirely on the decisions we all make now and over the coming weeks. Since the start of this pandemic, it's been one race after another between us and the virus. First, we were racing to build up healthcare capacity to treat the disease and to develop a strong testing system to help slow the spread. And then scientists had the heavy lift of developing a vaccine. And now we're in a race to get people vaccinated before the variants can sicken and kill even more Minnesotans. And as I just mentioned a moment ago, right now, much of the world is still very much in the depths of the pandemic. The U.S. government has do not travel advisories in place for most of the countries around the globe, which is a sobering reminder that there's a lot of virus circulating still, which creates a lot of opportunity for the development and spread of further variants to the original virus. In Minnesota, we all know that we came down from a really considerable high peak in numbers of cases, hospitalizations, and deaths that we experienced in late fall and winter. But for several weeks, we've been seeing worrying signs and trending back up again. And while vaccinations are working to protect growing numbers of us, the risks are still there for those who remain unvaccinated and susceptible. Despite the fact that thousands of Minnesotans are getting vaccinated each day, cases have started going up again in all age groups, especially children and adults under 60 years. Over the past month, more and more people are being admitted to hospitals and intensive care units to treat COVID-19. And the average age of hospital admission is 10 years younger now than it was back in November. The average age of admission is now 59 years. Back in November and December, it was 69 years of age. And it's certainly true, and we're grateful for the fact that most of the people who get sick will recover, but not all of them. And we know that some people who get COVID-19 will suffer potentially very serious ongoing health problems. This is not just an issue for older people. We see these COVID long haul symptoms in younger people too. Now, I will note that the rate of growth in our cases has shown signs of stabilizing in the last week or so. So we still have steadily increasing cases in the range of 1,500 to 2,000 a day, but it's not the exponential rate of growth that we saw in late fall. Again, we're still seeing large numbers of cases each week, 10,000, 12,000 or more every week, which translates to very many people with severe disease needing hospital care and many people developing that long COVID with ongoing health consequences of unknown implications for their future health. Each death from COVID-19 has been a profound loss. And each death and each severe illness that we see right now, these days, when we're potentially so close to the end, has a particularly heartbreaking feel. This is not the time to let down our guard. This is the time to finish strong. We have to remember that some people, a lot of people, including children under the age of 16, cannot yet be vaccinated. So it's extra important that all of us who can be vaccinated do so in order to reduce the risk to them. The decision to get a vaccine is, of course, a personal one, but it's a personal decision that does impact everyone around you. Every person who chooses to get vaccinated is certainly protecting themselves in a very significant way, but also protecting their family, protecting their friends, protecting their teammates, and their community. You know, a common misperception is still with us, that even if kids do get COVID-19, it's not that big a deal because they don't get very sick. In fact, some do get very sick, and we do not yet fully understand the long-term health impacts of illnesses on kids, including multi-inflammatory syndrome in children, or MIS-C. In addition, we talk about this a lot, but I think sometimes people still don't appreciate the full significance of it. Even a mildly ill or completely asymptomatic child can transmit the virus to more vulnerable people in their family and broader community. And as we have been talking a lot about, even as we are adapting and learning from the pandemic, the virus is also adapting to us. We are experiencing a high circulation of various versions of the virus that are significantly more easily transmitted, more infectious, and which also appear to cause more severe illness. We currently estimate that more than 60% of all the COVID-19 cases in Minnesota that we're seeing now are the B.1.1.7 variant, which is more contagious and producing higher rates of hospitalization. The spread rate is a particular concern for younger people. Despite some positive signs in the very near-term data that I mentioned just a moment ago, the last month and more has been particularly worrisome, especially among younger Minnesotans. Just this week, we've seen the number of school-related COVID-19 cases in students exceed the high level set in November during the big fall surge. All that means we've got a lot of work to do to ensure that community transmission goes back down. And I don't just mean students or teachers or coaches or school administrators by we. I mean that we all have a role to play in giving our from becoming a much bigger problem that drags down a whole school, a team, or a season. That is why beginning on Monday, April 26th, in order to give Minnesota students the best chance to successfully conclude their school year with in-person learning and intact spring sports seasons, the state is increasing our testing efforts and support. We continue to encourage every student in middle and high school, regardless of their participation in extracurricular activities, to get a COVID test every 2 weeks. And now we are also strongly encouraging all student athletes and all Minnesotans of all ages who participate in organized sports to test every week. Our state is a national testing leader for our COVID-19 infrastructure. Testing is quite accessible to all Minnesotans, and now is the time to take full advantage of this resource that we've built up. Students and families can get tested at a no-barrier community testing site run by the state of Minnesota in several locations around the state. They can also access testing through Minnesota's no-cost Test at Home program, which is now even easier as students will be able to send their tests back to the lab through their schools. Of course, our local clinics and hospitals also continue to offer testing. Schools have a really key role to play in this added testing push, and we'll hear more about that in just a moment from Commissioner Mueller. Meanwhile, as we emphasize testing in sports and the protective benefits this offers, participants in outdoor sports will have the option to remove their face covering while on the field or court. But face coverings must continue to be worn while not actively playing, for example, on the sidelines or in the dugout. And face coverings must also continue to be worn at all times for indoor sports. I'd like to just note that these recommendations and precautions don't represent a ceiling, but rather a floor of precaution. Just because something is allowed doesn't mean it has a seal of approval for safety in the middle of a pandemic. Many people have circumstances that may require more caution. For example, multi-generational households with grandparents and school kids, or households with one or more members who have compromised immune systems or other issues that increase risk. We're all really tired of the pandemic and its many, many impacts. We are closer to the end now, but we need to hang in there a bit longer. How quickly we get to the end, what happens over the next couple of months for our community and specifically for our schools, is up to all of us. We can protect the progress we've made, and we can minimize the problems that we are beginning to see now. The decisions that each of us make to test, to mask, to get the vaccine impact how quickly we will get to the end of this pandemic, which we also desperately want. And with that, I will now turn it over to Commissioner Mueller.
Thank you, Commissioner Malcolm. Good morning, everyone. Throughout the pandemic, our schools have made tremendous efforts to support our students and families. And as Commissioner Malcolm explained, we are at another critical point with this virus, and we need to take action so that our students can continue with in-person learning and all of those other activities that make school experience a memorable experience. And testing has always been an important part of our strategy for slowing the spread of the virus. And now more than ever, especially as vaccines are not yet available for all students, we need to double down on testing. And so we are strongly encouraging our middle schools and our high schools to provide testing for our students every 2 weeks. And we are asking our students and strongly encouraging our students in middle schools and high schools to be tested every 2 weeks. We're doing this by making it more accessible to our students in their schools. So in order to increase that access, these are some of the things that we are strongly suggesting that schools be able to provide. In order to continue to offer in-person COVID-19 testing for middle schools and high schools every 2 weeks, our schools can put that in conjunction with what they are currently doing for our staff testing, which we have been doing for the past 6 months. Other ways that schools might be able to do this is also to make a Zoom-enabled COVID-19 test available every 2 weeks for any middle school or high school student who would like to test. They would be able to pick that up, take it home, take the test, and then return it to the school, and the school would then send it to the lab. Every effort by our schools to support COVID-19 testing makes it easier for students to get the test that they need, especially students who may not be able to make it to a community testing site or other provider. These tests are going to be free for our students, for our schools, and for all of our sports teams. The state of Minnesota will provide test kits and resources for any middle school, high school, and organized sport teams that will offer testing for students and sports participants. Our schools also continue to play a key role in promoting testing opportunities in each of their communities, such as the no barrier community testing sites that Commissioner Malcolm talked about. Students are also able to order tests through the at-home testing program and return them to their schools to be sent to the lab. So that is the third way that we are making sure that we are providing access for all students who want to participate. Now, as a mom of 2 kids in high school, including a senior in high school, I know how badly we all want to make sure that our students can have the prom and graduation ceremony and everything else that comes with an end of a great school year and an end of a school career. And testing is one of the ways to be able to get that. Commissioner Malcolm also talked about making sure that we are having our students that are between the ages of 16 and 18-year-olds vaccinated and the availability of those vaccines. Those vaccines continue to be crucial not only for what our students are able to do and maintain while they're in school, but it also allows them to do the things that they like to do outside of school. We know that we saw over the winter in our sports activities that we had a number of teams that, because of close contact, were not able to play. Had the students had the opportunity and were able to have their vaccines, that would be one way that we would be able to continue, that students would be able to continue their testing. It does not have to be a heartbreaking end to a season, and it does not need to be a heartbreaking end to a school year. As our schools continue to do the work and be able to hold events like proms and graduation and all of the other things that come with moving from one grade level to the next or being able to graduate from high school, the Department of Health continues to provide guidance and resources that are going to ensure that the events that we have for our students and staff and families are safe. Their partnership and their support of our school community throughout this pandemic has been invaluable, and we have deeply appreciated our ability to work with them on behalf of our students, staff, families, and community. And with that, I would like to turn it over to Dr. Brooke Moore.
Thank you, Commissioner Mueller, and thank you, Commissioner Malcolm, for asking me to speak today on how COVID-19 has impacted children. As mentioned, I am a pediatric pulmonologist at Children's Minnesota. In that role, I consult on children in all units of the hospital, including the pediatric intensive care unit. As has been the case for adults, children's lives have been turned upside down by this pandemic. Thankfully, children have made up a minority of confirmed cases of COVID-19. However, as older populations have become more protected, particularly through vaccination, as mentioned, the proportion of cases in children, especially older children and adolescents, has increased. Studies have shown most children with COVID-19 are asymptomatic or have mild to moderate symptoms. Approximately 10%, however, will develop severe disease. Amongst those with severe disease, some will have critical illness requiring intensive care. Infants and adolescents appear more likely to be hospitalized and to suffer more severe disease. Death in children remains extremely rare. At Children's Minnesota, we have had a total of 385 admissions from COVID-19. 88 patients have required intensive care. 31 have been intubated and on a breathing machine. We have had 1 young adult death at Children's Minnesota. Nationally, there have been 297 pediatric deaths from COVID-19. Statewide, there have been 2 pediatric deaths. In the last week, we have had 11 admissions, 5 to our pediatric intensive care unit. 3 of those children are quite sick. This is double what we have seen on average in the last couple months. There is limited evidence about which underlying medical conditions in children might increase the risk for severe disease. Studies of hospitalized children have found that obesity was the most prevalent underlying condition. This is what we have seen at Children's Minnesota as well. Like national data, we have also seen that our Black, Indigenous, and children of color have been disproportionately impacted by more severe disease. As mentioned, children with past infection with SARS-CoV-2 are also at risk for developing multisystem inflammatory syndrome in children, MIS-C. MIS-C is a potentially severe and dangerous complication that can progress to shock with risk for damage to the heart, kidneys, and other organs. In Minnesota, there have been 81 cases of MIS-C. At Children's Minnesota, we have cared for 70 of these patients. All have recovered from their acute symptoms, However, at this time, it's too soon to fully understand what long-term sequelae these children might have. There are also increasing reports of children, even those who have had mild symptoms, developing symptoms of COVID-19 long haulers that are similar to symptoms experienced in adults. Children are experiencing other harm from COVID-19, including social isolation, food insecurity, lack of social structure, decreased physical activity, and increased mental health crises with both anxiety and depression. At Children's Minnesota, the mental health crisis that children and adolescents are experiencing during this pandemic has been palpable. Parental worries about visiting healthcare facilities have also resulted in a decrease in vaccination rates and late presentation for other serious illness. In Minnesota, we are behind by approximately 42,000 doses of routine recommended childhood vaccines and 21,000 doses of routine recommended adolescent vaccines. In order to decrease the collateral damage to children, we must all do our part so kids can continue to do the things that are important for their health and well-being, like attending school, participating in sports, and other important activities. As children have returned to normal activities, as I and Commissioner Malcolm mentioned previously, rates of hospitalization in children, like adults, are increasing. It is clear that the COVID-19 pandemic is not over quite yet. This means we are going to have to figure out how to live and raise our children when seemingly every action we take carries some risk. Studies have shown that transmission decreases when infection prevention measures are adhered to. When engaging in more normal activities, we must think carefully about ways to decrease risk. Staying home if you are sick or have a known or possible exposure, following the updated testing guidelines that have been presented today. This cannot be said often or clearly enough. We have a great responsibility to each other right now. There is no practice or competition worth risking someone's health or life. Get vaccinated when you are able. Get your children vaccinated when they are eligible. Wash hands frequently. Get tested. Wear a mask, even during sports. I know it can be hard to wear one during vigorous exercise. I'm a pediatric pulmonologist. I understand this, but it literally can save lives. Life won't completely return to normal for some time, but if we take these steps, we will be able to find a way to be active and be together safely and to get through this extraordinary time. Thank you, and I will now turn it back over to Mike.
Thank you, Dr. Moore. Operator, we are ready to take questions.
Thank you. As a reminder, to ask a question, you'll need to press *1 on your telephone. And to withdraw a question, press the # key. Please stand by while we compile the Q&A roster. Your first question comes from the line of Jeremy Olson with the Star Tribune. Your line is open.
Yes, Commissioner Malcolm, your weekly report does show a pretty substantial increase in K-12 student infections for the past week. But I wanted to ask if that is somewhat a circular argument. I mean, if a lot of K-12 kids have asymptomatic cases and we're testing more, that's going to result in more cases found, which is going to result in a recommendation for more tests, which is going to find more cases. Is that driving this increase somewhat?
It's a fair question, and certainly we want to find all the cases we can find so that we can interrupt those chains of transmission. I think we can certainly look at the test positivity rate on a more granular level and see that gives us a little bit better picture of the relationship between the volume of testing and the case finding that we're doing. I believe Chris Erzman's on the line as well for questions. Chris, if you're on the line, and if you have anything more to add on Jeremy's question, please do.
Yeah, I'm here. And Jeremy, the one thing I would mention is that I think there's sort of an implication that if we're identifying asymptomatic cases in kids, that suggests that those cases aren't really that significant. And it may be that for the student, the case is asymptomatic, but it's important to identify that case because that individual could go on to infect others for whom infection would not be asymptomatic and could be really devastating. So as the commissioner said, the goal of testing is it's not to get us into a circular do loop, but rather to identify those cases so that we can intervene and, slow down transmission.
Related follow-up question there was this Let's Play group kind of updated a lawsuit they had filed. They're basically arguing that the states failed to make a connection, a scientifically substantiated connection, I guess, between youth sports and infections in more vulnerable people, including long-term care. And I guess I just wanted to get your response to that. Do you feel like that connection has been substantiated, that these cases we're talking about in kids do bubble up to more vulnerable populations?
Well, I think we absolutely do believe that the in-depth epidemiologic investigations that we've been able to do in certain outbreak situations have quite clearly established that link. And I think you're seeing the same pattern and the same conclusions reached not just in Minnesota but all over the country. And CDC's guidance and others has increasingly suggested that we need to pay special attention to these kinds of gatherings and activities. But Chris, anything else that you would want to add specific to the sports epi?
Yes, I mean, I think that the way that we're looking at the broader perspective of transmission, we're looking at how cases in a particular ecosystem, in this case the sports ecosystem, contribute to cases across the community. And I think that the let them play may be saying, well, if Michael gets COVID, then there must be a direct link from Michael to an elder in a long-term care facility for there to be a connection. And while there have been some situations in which we we've been able to track more precisely some chains of transmission, I think that our point is that when we have a particular ecosystem that's contributing to increasing spread in the community, that ultimately pushes on the spread in our long-term care settings and in those vulnerable populations.
Thank you.
Your next question comes from the line of Catherine Richard with Minnesota Public Radio. Your line is open.
Yeah, hi. I'm going to leave some of our good education questions to our education reporter, who I know is on this call as well. I have a bigger picture question around vaccine uptake. More and more, what you're telling us is sort of playing out against the backdrop of what appears to be kind of a slowdown in vaccinations. More and more local public health and pharmacies have more supply than they can get out the door. They're putting call outs on social media to get people to come in. They're telling me that they're having a harder time filling those appointments. What do you guys make of this? How does this affect our goal of getting to 80%? And how will you respond to what appears to be sort of the slowdown in vaccines?
Catherine, this is Jan. We are beginning to see signals of some of that happening. We're trying to get as clear a picture as we can about what the issues are, what's driving that slowdown, and it's certainly not everywhere, but it is. We are hearing more of those same reports. We've always known that the point would come in the vaccination effort when the strategies to reach people were going to need to get more targeted, more specific to the circumstances of each population group. Probably a lot more kind of outreach at the small group and individual level. So this is not unexpected, perhaps a little earlier than we had hoped or thought, but I think the various, the variety of strategies that we're using to work with employers, to work with community groups to sponsor and organize events that are more accessible and perhaps get a different response when they're organized by trusted community leaders. But in addition, the healthcare systems will continue, and the pharmacies will continue to do outreach to their patient bases and their local communities to encourage vaccination. So I think we're definitely going to, and there's no question that we're going to keep up all of our efforts to encourage people to get vaccinated and to do so as soon as they can. I think there may be a sense that I'll get around to it, eventually, but we will continue to stress the message that to be able to get back to the activities we're so eager to get back to, and to protect some of the people who are still very, very vulnerable, getting more people vaccinated sooner remains really urgent. So appreciate very much folks on this call, helping us to get that message out and to try to really, kind of paint the picture for Minnesotans that we are still in a vulnerable situation here with regard to the pandemic itself. So getting vaccinated as soon as you can remains so important, not only to protect yourself, but to help stem the tide of these cases.
Yeah, and just to follow up, oh, I'm sorry, Chris, go ahead.
Yeah, Commissioner, I was just going to add two things to that if I could. One thing that we had heard, so I want to make sure that people are very aware of this, is that vaccination is open to everyone in Minnesota who's 16 and older. I know we've talked about how, certainly there have been some groups that we've continued to prioritize, and I think we've gotten some minimal feedback that there may be some confusion. Anyone in Minnesota is eligible to be vaccinated at this point, even though we may be targeting vaccine in some areas. So just want to make sure that that's very clear to everyone. And then the second point I'd make to the commissioners, better to get it now than to wait. I think a lot of people have taken the approach, one that, I'll let someone who is more vulnerable than I get the vaccine before me, which is totally honorable. And then also, I'm not a computer ninja and I don't want to be up at midnight trying to find an appointment. I'm just going to wait. And I think to both of those points, I think we can say, thank you for allowing others to go first, but it's okay now to take your place in line. And then second, to say that you don't have to be up in the middle of the night or be a computer whiz to get an appointment at this point. So just to kind of make those two points.
And if I could just follow up on that, is the state considering dialing back that requirement that vaccines be used in this very, kind of short amount of time after they're delivered to the place where they're going to be administered?
Yeah, actually, Catherine, Jan again, we will continue to look at the data and try to understand the value of those various performance measures. We have heard and are in dialogue with the providers that given the phase we're in, a longer time period in which to administer the doses is going to be a necessity. So we'll be talking more next week about our equity strategy overall and how that continues to evolve, and some equity metrics that we're adding into the mix. And as a part of that, we will be talking about some adjustments to those timeliness goals as well.
Any idea on how much longer pharmacies or providers would get to get those shots?
Well, as you know, we've always had both metrics of striving to get 90% of the doses out within 72 hours, but as close to 100% as possible within 7 days. So I think you'll see more of the emphasis on that 7-day metric, and still keeping a goal for getting as much as we can done within the first 3 days, but reducing what we're thinking about is reducing the percentage of doses that would be expected to be out in that 72-hour period.
Okay, thank you.
Your next question comes from the line of Dave Ulrich with Pioneer Press. Your line is open.
Yes, hello. Regarding testing at schools, can you very quickly, because I'll have a follow-up, explain to me how many kids are getting regularly tested right now?
I would ask Commissioner Mueller if you happen to know those data. We also have Dan Huff on the line from our testing team who might be able to answer that as well. Commissioner Mueller, do you have that, or should we call on Dan?
Commissioner Malcolm, we don't have that data. We know that we have not been offering them through schools. We have not been offering tests through schools, and so that's why this looks different. I believe that Dan might have the information about just students in general using the community sites.
Yeah, thanks, commissioners. I don't have the exact numbers right now. We have seen a increase in testing among our young people, our students, children, adolescents at our community testing sites. That's really encouraging. As you know, we launched this push really at the beginning of the year, even then sensing that we needed to do all we could to protect our children and to protect those who interact with our kids. We'll follow up with you though on those exact numbers.
Thanks, because the question is, it seems like it's not enough, and it's nowhere near enough. And so community sites and the ability to order an at-home test by mail, I know I do that regularly with my kid. A lot of his peers do not, he tells me. And my question is, how is this going to work now? Are you basically going to, at every school, have just piles and piles of these vault return mail tests so that kids can do it and right there in school at any time of the school day? How is this actually going to look?
Dan or Heather?
Sure, thank you, Commissioner Malcolm. I'm happy to start, and then Dan, if you guys need to pass it to you, I'd be happy to do that as well. What we know is in the process is that we currently have tests that are available to our schools on a regional basis. And so it goes by specific areas over a 2-week cycle. And so as we have resources shift to a school, they are then able to test. We know that on those days, and we collect that into all of those tests from that region, and then they are sent to Vault. And so it's going to follow the exact same schedule that we have utilized with our teachers over the past 4 to 6 months to be able to then add in additional tests for our students. And Dan, I don't know if you'd like to add additional pieces.
Yeah, thanks, Commissioner. I think it's important to remember this is about local control at the local district level, and then how does the state provide the resources and the support for local school districts. This is not a requirement. We're strongly encouraging schools to offer this, and we are providing the resources. So how schools decide to operationalize this is really up to that district and how they see it working best. This is adding a new option. So we have our community testing sites, our mail order site. We have, private pharmacies and clinics that offer testing. What we are doing is offering one more resource to make testing as accessible as possible for everyone and every student in Minnesota.
Okay, just a final clarification. Would you, if I'm a school superintendent and I call you up and I say, yeah, I heard about this, so what do you think we should do? What would you recommend?
Well, if the question is for me, I would say I would definitely do it. You have to look at your own capacity. We know that school districts are stretched. This has been a difficult time for all of us, especially for school districts. But that is why we're committed to making it as easy as possible. We have a whole packet and guidance of how to do this. And it can be, as Commissioner Malcolm and Commissioner Mueller described at the beginning, you can offer the testing right in school, given parental consent, through a Zoom-enabled call with Vault, or you can send them home so that the parents work directly with the child in Zoom-enabled call with Vault. One thing that is important, this is absolutely dependent upon parental consent. Our schools, the state, we will never test a child without the parents' consent.
Okay, thanks, guys.
Operator, we have time for one more question.
All right, we have a question from the line of Elizabeth Chapman with Minnesota Public Radio. Your line is open.
Hi, thanks for taking my call. I'm curious, if variants affect kids differently and there's no vaccine for kids, can you offer more guidance to parents on whether it's safe to send children to school or sports or summer programming? What should parents know? And secondly, I'm wondering if we're going to see in coming days and weeks a change in school or sports policy because of what we now know about how these variants affect children differently. Will spring sports seasons continue? Will schools change their programming to distance more? Will summer programming be affected? Will we see graduation and prom guidance affected?
Well, this is Commissioner Malcolm. I'll start and then ask Commissioner Mueller to comment as well. I think that's just precisely why we're announcing this expanded testing encouragement and resources so that we can try to impact the current rates of case growth. As well, we continue to urge that folks pay attention to all those other precautions. I mentioned, that these recommendations we know these are ways to, increasing vaccination and increasing testing can help us protect the ability of schools to stay in person, can protect the ability of sports to continue, and make possible those very important ceremonies and markers of the end of the school year and the end of a K-12 career for many students. So it's precisely so that we can keep going on in-person learning and these other valuable activities that we're encouraging people to not let down their guard on those other mitigation efforts, and in fact to step it up when it comes to testing and vaccination in particular. Commissioner Mueller, anything you would add?
Thank you, Commissioner Malcolm. I think the other piece is that we have had in the safe learning plan from the very beginning a really scaffold approach and being really thoughtful about how it is that we would be able to continue to support in-person learning as much as possible. And so if there is a school or that is seeing high increases in cases, then they can move to distance learning for those 2 weeks in partnership with their regional support teams and then have the opportunity to come back. Our goal is to keep as many students in as possible, which is why, again, as Commissioner Malcolm articulated, we need to have testing available. We need to vaccinate as much as possible in our 16 to 18-year-olds. And when this is available for our younger students, to be able to do that for our younger students as well. It really gives us the opportunity to think about the data that we have in front of us, what is happening in each of our school communities, because it isn't looking the exact same everywhere. And so really using that scaffold approach that we've had in our safe learning plan since the very beginning.
I think my follow-up question to that is, do we know more, or do we have an estimate about when Minnesota children under the age of 16 will have the chance to get vaccinated?
Yes, and Chris Erzman can comment on this further if she has more information, but we do know that clinical trials are underway and that actually Pfizer has already filed for expansion of their emergency use authorization to go down to, I believe it's age 12. And that decision from the FDA would be expected as early as mid-May, I believe. Chris, did I get that right? Any corrections? Or?
Yeah, no, that's correct. Both Moderna and Pfizer have been doing clinical trials in the adolescent, the 12 to 15 or 12 to 17-year-old age group. Pfizer has submitted to the FDA, and it will take a few weeks for that to be reviewed. The thought is that the Vaccine and Related Biologics Advisory Committee probably doesn't need to meet. So as the commissioner said, likely there'd be information on that mid-May or perhaps a little bit later. And as I said, Moderna does have clinical trials going, so I would expect that we would be hearing from them sometime this summer. So that would add to the number of vaccines available. And then for children, we won't expect to see vaccine for the younger ages until 2022.
Thank you.
All right, that's all the time we have for today's call. We invite reporters with any additional questions to reach out to our office this afternoon. Have a good day, and we will talk with you again soon.